The Infant Mortality Report is a collaboration between Franciscan Health and Broad Street. It's a customizable data dashboard on the Broad Street platform that was created by the author Kailama Kale Mahoihoi Porter. My name is Tracy Flood, and I'm the CEO and co-founder of Broad Street. Broad Street is a software company for social good, and Franciscan Health is a 12-hospital health system primarily located in Indiana with one location in South suburban Chicago. We are going to dive into the demonstration and walkthrough of the report in just a moment. First, I'd like to talk about the goals of the report and the framework of the report. Before we do any of that, I'd also like to pay tribute to those who are working to prevent infant mortality currently in their communities. The topic of infant mortality is an important one, and we understand that data and dashboards are only the beginning. Addressing a topic such as this takes many stakeholders working together over many years. While dashboards can offer an opportunity for an objective view, we must always keep in mind that for every data point we see, a young life was lost and a family mourned. It reminds us that each life is precious. Infant mortality itself is often preventable, and we must come together to support and celebrate the hard work of those who already provide evidence-based solutions at the local, state, and national level. It's because of their work that more babies have lived. The goal of the Infant Mortality Report is to empower those who are working to improve the lives of infants and children by providing access to data. To do this, we wanted to find the best information possible from reliable data sources for both data and promising interventions. Data include information from the Centers for Disease Control and Prevention, the U.S. Census Bureau, the Health Resources and Services Administration, or HRSA, Healthy People 2030, the American College of Obstetricians and Gynecologists, or ACOG, and the U.S. Preventive Service Task Force. The framework for the Infant Mortality Report uses the County Health Rankings and Roadmaps model in order to encompass major health outcomes, health factors, and evidence-based policies and programs that may help with planning prevention initiatives. Health factors include the upstream social determinants of health in the categories of the physical environment, social and economic factors, clinical care, health behaviors, and for this report, we assembled data on health outcomes. Health outcomes include low and very low birth weight, which are risk factors for the major outcome of infant mortality. We also took a deeper look into the topic of infant mortality to include trends over several decades, the timing of the infant death, distinguishing between deaths in the newborn or neonatal period, which is in the first 28 days of life, and deaths occurring afterwards in the post-neonatal period. We believed that this distinction was important because causes of death do vary between these two time periods. Whenever possible, we reported racial disparities. Looking at health factors, the physical environment includes the mother's womb and the home environment, and for this reason, the social and economic factors center on maternal demographics, such as race, poverty status, marital status, and we did look at teen births as well. Clinical care indicators include OB/GYN services and insurance status of the mother at the time of birth. Health behaviors included early prenatal care and smoking during pregnancy, which, together with low birth weight and very low birth weight, are major risk factors for infant mortality. In many cases, we were able to find racial disparities in health behaviors, and we focus on racial disparities because some races are at a higher risk of infant mortality than others. Now that we've covered the goal and framework, let's dive into the demo. This is what we are going to create. This is what's called a Broad Street data story. It's also known as a dashboard or a report. You will notice that the entire storyboard is built on cards with lots of data visualization cards that can be customized for your community. To create a story like this for your own geography or region, the first thing you need to do is to create a Broad Street account. This is easy and free. We only ask for your name and email address. Then, when you are ready to run a report, come to the Broad Street homepage. Under Create a New Story, you will see a button for infant mortality. Click that button and it'll prompt you to create a story for a new or saved area. You can define your area by a list of counties, cities, or zip codes. I'm going to run a report for Broad Street's hometown of Milwaukee, and in the background, the Broad Street data engine will be pulling together the different data for the counties that I've selected. First, generate the area so we can align cities, counties, and zip codes all together. You can delete any that you don't want, but I'm going to click Next. Welcome to our infant mortality report. At the top of the report, you will see a purpose statement followed by some static data visualizations and overall background information that can explain some important definitions such as what is an infant. Following this informational section are the data cards or datagrams, and we'll definitely dive into those in just a moment. First, for the background information. For us, an infant is a child that is less than 1 year old. We also define that a neonate or newborn is an infant that is less than 28 days old. We define the infant mortality rate as the number of babies that die per 1,000 births, And then we include this section to think about how infant mortality in the United States relates to the larger international perspective. We provide additional background information such as the causes of infant mortality, and we bring together some information on the most impacted demographics that we discuss later on in the report in the datagrams. Regarding racial disparities, these are national numbers, and we have local level race data later on in the report. And as you can see, babies with the greatest disparities are those born to Black and African American mothers. Native American and Pacific Islander mothers also face higher infant mortality rates. You may be wondering why there are not data on Hispanic mothers included in this report. The reason is because the Hispanic infant mortality rate is actually lower than the all-race infant mortality rate. For this reason, the report focuses on race rather than race and ethnicity. Infant mortality is lower for mothers who are married. We have this image to illustrate the importance of social support and the lack of social support as a risk factor for infant mortality. Now we move on to our first section with background information and datagram cards. In this section, the background information covers newborn and deaths within the neonatal period, as well as older infant deaths. Then these cards provide the first snapshot for infant mortality. All of the data cards can be expanded. In this first card, you can see a datagram of how many babies are dying and the rate. For Milwaukee, it's relatively high, which is really driven home by this benchmark card to the right. At Broad Street, we like to use national benchmarks to help communities understand how they compare in the U.S. The next card indicates the timing of infant deaths and shows whether the infant mortality rate has gone up or down in the last 2 decades. Next, you can see a banner that points you towards another potentially helpful resource. And then you can see a section that examines local-level infant mortality racial disparities. This is a good time to talk about how these stories can be edited, so we're going to go ahead and move on to editor mode. This is the storyboard in editor mode. While we look at these deeply troubling disparity data, I want to point out the anatomy of a Broad Street story, which is highly editable. If there's anything you don't like, it can be removed, including the words in any of the background sections. You can also remove the sections themselves, and you can remove any datagrams which you may not want. If there's not a population of a certain racial group that is large enough to generate an infant mortality rate, then the card will show no data, like this card here, for Native Hawaiians and other Pacific Islanders. To delete this card, look to the card anatomy. Each card has an area tag, which can be changed, a citation, a save button, which can add a card to another story or even post it on social media, a favorite icon, which can save a card to your favorites on your Broad Street account, and a button for more, which allows you to delete a card. You can remove datagrams, cards, words, and sections, and you can also add cards, words, and sections if you want. Moving back to the finished product, we do have data on low and very low birth weight. Both of these were illustrated visually to show how these infants have higher risks of infant mortality, which is what is described in the background section, along with information on how low and very low birth weight relate to early prenatal care and smoking during pregnancy. The cards in this section are some of my favorites because the way that they turn red when the number is especially high compared to the United States. This can help communities highlight what areas they might need to work on and what things they can be focused on to address infant mortality. Next, we move to the maternal demographics section. The data in this section are for women of reproductive age, which we have defined as 15 to 50 years old in order to align with the most recent recommendations from the U.S. Census Bureau. We've also included data on mothers of infants, which we define as women in this age group who have given birth in the past year. So here you can see the number of women, the number of births, the mothers of infants by marital status, race, and poverty. We've included data on mothers who are living at or below the poverty line, as well as the 200% poverty level to demonstrate who may be eligible to receive social support services. Here are data on mothers by marital status and map cards for marital status and race. The map cards are helpful datagrams for targeting because you can see at the neighborhood level where these mothers of infants live and plan outreach and intervention programs accordingly. The next banner points out that WIC has been shown to help reduce racial disparities and provides a link to check the requirements on who qualifies for WIC in your state. This section provides information on teenage births, since babies born to teenage mothers are also more likely to die in their first year of life. We provide a similar card structure to other sections with a rate card, including benchmarks, and a map for targeting valuable resources to places where they're needed the most. The last section of datagrams covers access to care. One piece of background information that I want to point out is that babies born to mothers who did not have insurance to cover the birth are 2.6 times as likely to die. So when we look at this card and see that the state and national benchmarks that appear on hover, we need to remember that the real benchmark to strive for is 0%. The other cards in this section include information about births paid for by Medicaid and a map showing the rate of OB-GYNs that are providing care in each county. I'm going to expand this map card and take you to the map room to show you how to zoom in on your area. There's a lot more that you can do in the Broad Street map room, including adding indicators and layering indicators, as well as saving them to Datagram cards. But for now, we're going to go back to the infant mortality report. The last sections provide more information on access to care, maternal mortality, and promising interventions. This list of interventions was compiled from recommendations made by the U.S. Preventive Service Task Force, County Health Rankings and Roadmaps, and ACOG, in addition to peer-reviewed journals. Finally, we provide our reference list. Thank you so much. If there's anything we can do to help you with Broad Street and customize this report tool for your needs, please do not hesitate to reach out. We have a help button in the upper right-hand corner of the Broad Street homepage, and if you reach out to us through there, we'll be sure to get back to you. Thank you again, and enjoy the infant mortality report.